Hello everyone, my name is Mia. I'm an aesthetic practitioner and nutritionist. Today we are unpacking all things acne. I have written it all down so that I don't miss anything because there's a lot. In this video, I'm going to talk about the different types of acne, the different causes, including diet, food, nutrition, supplements, lifestyle, habits, you name it, as well as products or ingredients that can help. And then we talk about in-office treatment, something that I can do for you to help clear your acne. We're also going to talk about medications such as Accutane and different ones that may or may not help your acne in your case. Of course, every person is different and everything needs to be factored in accordingly. So this is still a bit of a generalization. Take what you can and apply what you will. But if you want something specific for your acne or for your skin, you can always drop a comment or DM me, or we can just do a consultation one-on-one, whatever is comfortable with you. But for now, let's get into the video. Let's talk about factors that are causing blackheads, whiteheads, pimples, pustules. If you're someone who does a lot of makeup, you need to make sure that you are washing the brushes and washing your makeup sponges, because you need to understand that bacteria, when it goes on your face, including your hands, which is why I always try to tell my patients to stop touching their face. You're constantly transferring bacteria onto your face. That's just going to make things worse. Okay, that means you have bacteria and then you already have oily skin, and what you'll end up doing is that bacteria is either going to spread and you'll have breakouts along your face. Okay, and it's just not going to be fun. So please wash your makeup brushes, your makeup sponges. Now, dairy also plays a factor. A lot of people who are lactose intolerant, which South Asians, I'm South Asian, and a lot of what I'm saying is tailored to South Asian skin, are going to react to dairy and wheat, and that is going to look like a puffy, red, sensitized face, along with breakouts, either red bumps, some may form whiteheads as well around this area, all of this. I'm using the front camera and I'm looking at myself as well. So it's the first time we're doing this together. Okay, now I also want to debunk what is known as comedogenic products. What are comedogenic products? Products that block your pores or clog your pores. If you have an open pore and anything that goes on top of that open pore is going to go inside the open pore. When it goes inside and it doesn't come out, which means you're not washing your face properly or not exfoliating, it's going to stay in the pore. When it's in the pore, it's going to block it. It's as simple as that. If you're someone who is acne prone or prone to breaking out a lot, you want to stay away from products like Vaselines or occlusives, essentially. Beeswax, oils, these are thicker products and can therefore be difficult to literally remove or pull out from the skin, right? Or wash out. But if you are going to look at silicones are not the problem. The problem that needs to be treated is the open pore. We need to work on why the pore is open and make sure that there isn't any irritation around it, so that it's not as reactive and you're not immediately breaking out as soon as something goes on your skin. So it's usually not the product, it's your skin or your face itself, which is what needs to be worked on. So I personally get a little icked out by people who are just bashing at like dimethicone or ethyl palmitate for being comedogenic. But you need to understand that it's not the product. Sometimes it's your face, and that's what we're working on today. Now, another thing that plays a factor in your acne is the climate. It's your everyday lifestyle. It's also the foods you eat and the products that you apply. We've covered that products that you apply don't have a huge role to play in it. They do have a role to play in it, but not as big as you think it is. Your climate, if it is humid, if it is hot, then if you put occlusives on your face, they are going to block, and then combined with the hot and humid climate, it's just going to congest your face. What we need to do is get rid of that congestion. And for that, I would say switch to products or moisturizers rather that have more humectants in. That includes panthenol, that includes glycerin, that includes hyaluronic acid as well. What do humectants do? They basically draw in moisture from the environment into your face rather than sealing it off. You want to seal it off when it's winters, but when it's hot, you want to draw moisture in from the air because the air has a lot of moisture to give. One thing that I want to emphasize on is to not fall for any brand that promotes the solution to acne in a serum bottle because, like I said, acne, pimples, breakouts, different types of acne are a combination of different factors. Your environment, your habits, your food, including your nutrition, which is your supplements, your hormones. All of these and more have a bigger factor to play, and you literally cannot put all of that in a bottle. And any brand that is trying to sell you that is selling you a lie. So I would advise you to not fall for it, or at least not waste your money there. Okay, another thing that matters is the location of the acne. Now, when we're talking about forehead acne happens when the oil from your scalp seeps into the pores literally on your forehead. Okay, there's bacteria, there is a combination of oil and bacteria, and then dead skin as well, and that can form bumps on your forehead. This happens frequently with people who have shorter hair as well, and people who oil their scalp a lot, especially in the front. So what happens is literally the oils travel into the scalp and then they kind of sit there and they accumulate bacteria and they accumulate germs, and then they start forming pimples, like small pimples all around. So that is what forehead acne is, right? There are different products you can use to treat it, and we'll get to that at the end of this episode. um, okay, so the acne that you get from the ear to ear. Cystic acne hurts. It is deep inside. It is huge. It is red, with whiteheads sometimes, and it hurts deep inside. You can feel it. And that is hormonal. That has a lot to do with your hormones and your food. And I'm going to get into all of that too. But just to tell you that ear to ear, literally is what we say, ear to ear acne cannot be treated topically only. There has to be some internal work that goes into play in order to calm down the inflammation and calm down the breakouts. Okay, that can be in the form of oral supplements, that can be in the form of Accutane, medicines, whatever it is, even dietary changes on your part, because at the end of the day, this is happening within your body. Your body is creating this. So anything that we apply topically is only going to fix it temporarily. Okay, also, on the topic of that, even lasers can only work temporarily unless you're doing something about the hormonal imbalance that is happening on the inside. So let's get into that. Number one, dairy contributes to acne. Dairy and wheat. This can inflame your face, make it red and puffy. If you're South Asian, you will most likely be lactose intolerant, as well as have an intolerance to casein, A1 casein, which is the protein in milk. But a lot of people respond better to having lactose-free milk. I'm not going to say go off dairy completely. I completely understand if that's part of your routine. It's part of mine too. I love my cup of tea every day. So I would say switch from lactose to lactose-free milk, and you will literally watch your face overall just deflate. The number of people who've never even noticed they were inflated to begin with, they switched to lactose free and they watched themselves, their faces deflate. So I would say at least for a week, just go off dairy, go off wheat if you can, and you will see the change itself. Even your skin will start looking a lot clearer, at least a lot less red. Insulin. This is a big one. Insulin is a hormone that is released by your pancreas every time you consume a carb in the form of sugar, maida, rice, wheat, sugary foods, starchy foods, including anything that tastes crispy, even if it's spicy or sweet. So every time you consume carbs, glucose is released into the blood. Okay? When glucose is released into the blood, the job of insulin, which is produced by the pancreas, is to go convert the glucose into energy and send it off to different departments of your body, to the muscle for energy, sometimes into the body as fat. Now, what does that have to do with skin, right? The more you eat, that is, the more glucose there is in your body, the more insulin there's going to be in your body as well. Insulin stimulates the male hormone androgen to produce, okay? Females have both estrogen and testosterone in their body. Androgen is a form of testosterone, but it can manifest on your face and body as hair, coarse hair growth ear to ear. Okay, some women have it on their chest as well. You can have more oily skin. You can have pimples, deep pimples, especially again from here all the way to here. It is not fun. If you are susceptible to PCOS, or if you don't have it already, you will become more susceptible to it, but that's a separate topic. We're talking about skin and acne only. Because this is happening internally, your body is the one that is creating the acne. The only thing that you can do on it are two things. Number one, you can stop the frequent eating. That way, your body won't have to constantly produce the insulin and androgens, right? That way, it can actually just produce insulin whenever it is that you are eating. Meanwhile, the storages or the fat storages in your body are going to naturally release glucose without raising your androgens. I hope you're able to understand that. Number two is either don't eat foods that are too high in carbs or have a high glycemic index. I would rather you eat foods that are higher in protein or even fiber so that your body again isn't producing as much insulin, therefore is not producing as much androgens. Right. Okay, now what are closed comedones? Closed comedones are a combination of oil and dead skin. And then they form very like underneath the surface, and they don't really fully surface to a whitehead until much later, and then it sort of flares up. So you want to get it into the early stages. Ingredients like salicylic acid do help. They help reduce the oiliness and sort of regulate the oil production that is happening on the face. Azelaic acid is great, so is adapalene. How to use it, when to use it, I would say adapalene works better for closed comedones. Azelaic acid works for redness and irritation, and just generally it's also a tyrosinase inhibitor, so it would help with the hyperpigmentation or the post-inflammatory hyperpigmentation as well. How should you use it? I would say it's person to person. It wouldn't be fair for me to just tell you how to use it. You could have dry skin and I could be giving you salicylic acid just on YouTube, and that wouldn't be right. So, again, these are three ingredients that I would say help with acne. But if it's cystic, if it's happening inside your body, you definitely need to cut down on your carbs, or you can visit a professional who can either help you give you supplements to control the amount of insulin that your body is producing, as well as make you more insulin sensitive and reduce the amount of androgens that are being produced. Other than that, niacinamide is great for regulating the oil production as well as post-inflammatory hyperpigmentation, and it helps with redness as well. So these are again products not to be used all at once, but to be incorporated in a routine designed for your skin and your skin type only. I do online consultations, so you're welcome to schedule one with me if you choose to do so. Please do moisturize. Make sure that your skin barrier at least is getting some hydration, because sometimes what happens is when you're stripping your face of all those oils and washing out, a lot of people think that their oily skin is a problem and they're overwashing or stripping literally the oil from their skin, which what they don't realize is actually beneficial to them as well, to keep a certain pH of the skin. Also, like when you head into perimenopause and menopause, your skin gets drier, and oily skin doesn't age, and well, it ages slowly. So anyways, your oily skin is not a problem. Please do not like strip your barrier. Keep it lightly moisturized, even if you have like a zillion pimples on your face. Lightly moisturized which are humectant based rather than occlusives. Okay. Now, in office, um, I don't care what other people are doing. Okay, what I will tell you is that South Asians will pigment a lot more. Anyone who is deeply melanated, so I would just say anyone along the equator, are more prone to hyperpigmentation and pigmenting. So I would say stay to lighter lasers, and these lasers are mostly for hair growth, right? So the one that I would do now, I design all my machines myself with a biochemical engineer, and we tailor it to the skin types that we see in office, right? Or the skin types that I deal with a lot in office. Therefore, my machine settings are different than what you would normally find in other offices. And anything that is causing any acne that is caused by a hair root or hair growth that is happening underneath the surface of your skin, lasers can prevent acne from being caused by the hair that is trying to push through the surface of the skin, but isn't because there's skin over it or there's hair growth happening. So that's for sure. Please don't wax your face and don't bleach your face. Let's talk about Accutane or isotretinoin and Tret. What is Tret? Tretinoin is a vitamin A derivative. And tretinoin, every retinol or retinal, even adapalene is a version of vitamin a much lighter version of vitamin A. So let's just talk about Tret. It is extremely irritating. I do not recommend it unless these are people who are directly under my supervision and my care. Okay, I will never recommend it to anyone. I have done a tretinoin course because I could manage my skin and tailor it accordingly, right? And I did it because I had to get rid of the acne and the acne marks. But even that, again, is a topical fix only. If you have acne that is being caused by hormonal imbalances, which, by the way, South Asians, vitamin D, ferritin are already low. So you should already start supplementing for that or get your tests done and make sure they are way above the baseline level. That aside, oral Accutane is going to do what Accutane does from the inside, but on a slower basis. So Accutane works by increasing the skin cell turnover, okay? And in that process, there's a purge that happens, which means any sort of acne that was forming inside your skin is gonna come out, okay? It's gonna come out big and ugly, and that's why a lot of people hate tretinoin. Accutane is going to do that a lot slower, so you're not really going to feel it. Your skin is going to get very dry. It is not for everyone. It is for few people, those who can tolerate it, and it should be done under the care of a physician or someone who's a pro and knows what they're doing. So that is something that I want to say. A lot of people like to supplement with zinc, which I'm not all for. I feel like the only times you should use supplements is if you're actually deficient in them rather than just taking it, because zinc can interfere with the absorption of iron and copper. So if you're South Asian, your ferritin is already on the lower side. If you are taking zinc when you do not need it, it can be dangerous for you. So if also, it's not going to do much for you. Zinc isn't going to clear your skin or give you glass skin. What you need to do is make sure that your hormones are in check, your diet is not carb loading, um, or is not a high glycemic index. You are having food that is at least lactose free. You are using clean makeup brushes. Your skincare is simplified. Your barrier is protected, and you are not constantly touching your face. And you're tailoring your skincare routine to the weather or the climate around you. Okay, and I hope this helps. I hope I covered everything. Please subscribe or like and comment below what I should make a video on next. And I hope I've been able to do everything. If not, I'll make a part two. Lots of love. Bye.